Now joining us on this segment, as promised, we have Zach McGill, the CEO of Perk Health. Zach, welcome to the program.
Hi, thank you. Glad to be here.
Oh, great to have you. Let our audience know what you're doing with Perk Health, and then we want to dive a little bit more into to kind of the nitty-gritty here.
Excellent. So at a very high level, Perk Health is a corporate health and wellness solution. We do things quite a bit different than some of the other things you might have seen out there. One of the biggest differences that I think is also one of the most interesting is when a user is first signing up for a platform, we have them take a personality assessment. And with that information, we can figure out some important things about that individual when it comes to behavior change. I mean, when it comes to helping them find a way to sort of live a healthy life in a way that will be both sustainable and enjoyable for them. And what we do is we sort of coach them through that with a virtual coach that we've created. So it's a completely virtual algorithm-driven coach that, based off of unique insights about the individual, can help them in a sort of wide range of things, from getting fit to eating healthier to losing weight, and then soon down the road we'll be going down, building out applications around mental health and diabetes management and things like that.
Hey, Zach, what was the light bulb that went off that gave you the idea to really start Perk Health? What did you see? And
yeah, no, that's a long story, but I'll try to make it quick here. So I started Perk Health with my childhood best friend, a guy by the name of Doug DeBold, and me and Doug actually met back in junior high track and field. Fast forward to us sitting, sort of in our dorm rooms in college, right? That sort of classic startup story. Looking at lots of different business ideas and looking for the one that we thought could, be something that turned into something, of course, big and significant, but also something that could create a lot of value. And when we looked at where we thought we'd create value, we sort of looked at, our lives and where we'd gleaned the most value. And for us, it was definitely growing up sort of together in athletics. It was, and not just, sort of the health that we got from that, but it's really the love of the active lifestyle and the mentorship of the coaches, the camaraderie of the team. And we thought, wouldn't it be cool if we could bring, that to more people, kind of create a scalable model of what we had experienced and got so much value from. And so when we started doing that, we looked at those key pieces, the social piece. So we've recreated that, in the virtual world, and that's one of the things that's allowed us to show about 10 times the engagement of the industry norm for a wellness product. But then that piece I was talking about earlier, that coaching piece, what we did is we were looking at, what makes a good coach so great? What is it about real coaches that are so effective? And I think the thing is that they get to know, each person they work with at a deeper level than technology's really ever tried to do. And so that's where our sort of personality-based approach comes from, is trying to make it so that technology can understand people in the way that people can understand people.
Zach, this is Brent. For your business model, do you go direct to employers? Do you work with brokers and consultants? Is there a health plan angle with Perk Health? What's the model?
All of the above.
Okay.
So we go direct to employers. We are doing something pretty interesting right now where we're rolling out a free version of our platform. So in the health and wellness world, we're seeing a lot of fitness challenges right now, and they've been a really good thing at getting people engaged. They're fun. They are not definitely the end-all, be-all when it comes to long-term behavior change, but they're a great way to get people engaged. Yet a lot of the things we're seeing in the industry right now are still sort of paper-based and pretty cumbersome. So we're coming out with a really cool, fun, sort of really gamified version of that we're going to give to employers for free. And then some of these other bits I'm talking about, the virtual coaching around different outcomes a person might be looking for, and incentive systems are sort of our premium product. And then employers can also get both versions of the product through brokers, and soon, though we can't disclose quite yet, an insurance provider.
Now, so when you're looking at this space, are you seeing, are you benefiting from the consumerization of healthcare as a whole across the entire spectrum? So Doug and I at the beginning of the program talked about how the payers need to be more informed about, the consumerization of healthcare, employers, and those other stakeholders that we just mentioned, the brokers, consultants. Is your business benefiting from the consumerization of healthcare?
I'd say it is hugely, and the whole industry is. And I think maybe us a little bit more just because we really have focused from the beginning on sort of the end user experience. Doug and I are probably the type you'd expect to be running an app based business out of Silicon Valley, not necessarily your typical healthcare business. But I think the real driving force in the consumerization of healthcare here is choice of the individual, right? And I guess there's two things. One, there's just the fact that more people are insured now. That means there's more people that somebody is at risk for, which is good for the industry. But that choice piece, right? The idea that people now have the ability to sort of move, I think, has become this driving force that the payers and providers in the system are absolutely responding to. What they're realizing is that they have to become something that people actually want, right, at an individual level. And so they're starting to realize that they have to interact with customers, like any old retail company would. And I think that really aligns incentives, right? What it does is it makes it so that those payers and providers really want to show that they're invested in the individual's health and well-being in a broader sense. Because I think that's one of the, ultimately what the message around healthcare needs to sort of come to is that, this is about keeping you healthy and not necessarily just treating you once you land in the hospital. And I think as that trend continues, it's going to just benefit us more and more.
Zach, well, we really appreciate you joining us on the program. Let our audience know how they can find you.
Yeah, our website is just perkhealth.me. So it's PERK health.me. You can see a little bit of our background there, the story of my co-founder and I, and feel free to get a hold of us.
Hey, Zach, really appreciate you joining us on the program today. Have a great weekend up there in the Twin Cities.
Yeah, thank you so much. You guys have a good one.